Welcome to Emergency Insights. I'm your host, James Carter. Today, we're going to discuss an often overlooked but clinically significant condition that every healthcare provider needs to be aware of: Protracted Antidepressant Withdrawal Syndrome, or PAWS. PAWS refers to a constellation of withdrawal symptoms that persist well beyond the expected acute phase following the cessation of antidepressant medication. While typical withdrawal might last from 1 to 8 weeks, in PAWS, symptoms continue for months or even years. There are documented cases stretching up to 166 months, nearly 14 years, with an average duration of about 37 months. That's over 3 years of persistent, often debilitating symptoms. Let's start by looking at the symptomatology. PAWS presents with a wide range of psychological, physical, and cognitive disturbances. Psychologically, patients often report dysphoria, heightened anxiety, renewed or worsened depression, agitation, suicidality, and depersonalization, a feeling of detachment from oneself. These are not subtle experiences, they're life-altering, and they affect over 80% of individuals with the condition. Physically, the symptom list is just as broad and troubling. Patients may endure headaches, muscle pain, profound fatigue, dizziness, the classic brain zaps or electric shock sensations, visual disturbances, tremors, and gastrointestinal symptoms like diarrhea and nausea. About 75% of those with PAWS experience these somatic complaints. Sleep disturbances are reported in nearly half of affected patients, and roughly 1/3 report cognitive impairments, especially with memory and concentration. This makes it extremely difficult for patients to function in day-to-day life, let alone return to baseline health. So, who is at risk? PAWS is more likely to develop in individuals who have used antidepressants long-term, often for several years. Abrupt discontinuation or inadequate tapering protocols further elevate the risk. Those who've previously struggled with withdrawal or who have unique physiological vulnerabilities also appear more susceptible. The pathophysiology isn't fully understood, but it's believed to stem from neurophysiological adaptations due to chronic drug exposure, specifically receptor downregulation and desensitization. Importantly, this is not addiction in the classical sense. Rather, it represents a physical dependence driven by neuroadaptation. Management of PAWS is challenging. The cornerstone is prevention, specifically slow, controlled tapering under medical supervision. Once symptoms have begun, some patients respond to reinstatement of the original antidepressant, followed by a more gradual taper. However, many will require long-term support and symptom management. Pharmacologic options like benzodiazepines or trazodone may offer short-term relief, particularly for sleep or agitation, but they often fall short of resolving the underlying syndrome. Non-pharmacological support, psychoeducation, and reassurance become vital components of care. The impact on patients is profound. PAWS can erode emotional resilience, cognitive function, physical health, and quality of life. In rare but tragic instances, it may even contribute to suicidality. As clinicians, our role is to recognize the condition, validate the patient's experience, and guide them through what may be a long but navigable recovery process. In closing, protracted antidepressant withdrawal syndrome is a stark reminder of the need for careful, individualized medication management, particularly during the discontinuation phase. It challenges us to go beyond symptom control and practice thoughtful, long-term pharmacologic stewardship. Thanks for joining me today on Emergency Insights. I'm James Carter. Stay vigilant, stay informed, and as always, stay compassionate.